Okay, I love it. That's right. Get that cardio in.
Be in your now.
Love it, love it, love it. Be in your now. Woo! Pulling up the rear, but we going out.
I got behind the scenes.
Behind the scenes of behind the scenes. I love it.
76,000 women, 500,000 babies yearly pass from complications.
Okay, y'all, so let's talk about the other part about preeclampsia that you don't really hear a lot of people talking about. You guys, we are in for an absolutely amazingly fun day, but we're doing it for a purpose, and we are raising awareness for preeclampsia with incredible community partners, both locally and nationally. Don't forget, you will hear today some incredible testimonies, women who survived preeclampsia and how they are taking their experiences to make sure that other moms have safe pregnancies. You will hear about an even near unaliving experience. Do not miss out on that testimony because it is incredibly inspiring. Before that, let's check out some of the partners that are here and a little bit of what they have to say. Look at the t-shirt. Get into the t-shirt. Get into the t-shirts. Get into the t-shirts. Get it. Happy morning, y'all. Listen, your girl took a little bit to get her body up this morning. I woke up earlier than planned, but it took a while for the body to follow suit. You know what I mean? Anywho, I'm so excited to be attending this event today, to be participating with some of the most amazing organizations out there. You'll be able to see some of them a little bit later, but especially with the Promise Walk organization that is helping to raise awareness about preeclampsia. As you guys know, preeclampsia disproportionately affect Black women, and also hypertensive disorders affect Latina women as well. So this is a very important condition to raise awareness for. And while we are working on a better treatment than just childbirth, because preeclampsia is one of the primary causes of preterm birth, and while we're maybe working on a better prophylaxis than low dose aspirin and living a healthy lifestyle, it is important to raise awareness and to make sure that women are aware what preeclampsia is, that it does exist, that it affects 1 in 12 pregnancies in the entire world. So this is not just a US issue, a UK issue, an African issue. This is the entire world. And so it's important to know what the symptoms of preeclampsia are so that women can seek help early, because the earlier the diagnosis, the better the outcomes. So join me today, and a shout out to all the people who helped me raise the funds for not just the overall event, which surpassed our goal, but also for my particular team, the Healthy Bump Club team. Thank y'all so very much, because we surpassed our goal. So thank y'all to everyone who participated and those who donated directly and donated through me. I appreciate y'all, because this is an important condition, and the only way we win together, especially since all the funding cuts for research and things like that, is when we pool our resources together. This is that time where that is that momentum, that is that movement, is community. So thank y'all. Come join us and let's have a good time. Okay, y'all, I am here about to head on out and join the teams that are here, all the organizations. I know AIM is here, I know Earth App is here, Promise Walk, of course, and so many other amazing organizations that do the hard work of helping women to have healthier, more fulfilling, and better experiences while they're pregnant, and supporting in the postpartum period. So Healthy Bump Club is always in the mix. Y'all know we are always where the action is happening, where the work is happening, where the momentum is flowing. And I'm excited. I'm really excited. I couldn't get myself to eat this morning. Was trying to get the appetite going, but the body was like, girl, you're doing too much. It ain't that time yet. So I'm about to pack up my snacks that I have for the day to refuel. I have my water ready, and I'm about to get my skin ready. And I know y'all know that there is a brother out there, a clinician who just got tenure, so congratulations to him. And he has been raising awareness about the lack of scientific data about the help, or the efficacy I should say, of using sunscreen to prevent skin cancer. Specifically, I think melanoma is what he's been raising awareness about in Black people. So keep in mind, we do not just use sunscreen for the prevention of melanoma and other skin cancers. We also use sunscreen in the hopes that it helps for aging, gives us healthier skin so we look snatched into our 70s, into our 80s, and now into our 90s and into our 100s. Okay, y'all see some of those mothers out there, their skin is snatched, honey, and they be wearing their hats to prevent the sun exposure to their skin. So fun fact, I already have sunscreen on my face because I don't be using outside hands on my face. So I applied my sunscreen before I left the house, and that one I use a very thin gel. So in addition to that, while we are ending the summer season and heading into fall, I got my full thick season socks on, making sure that y'all know that it is always thick season. Okay, shout out to the thick girls who be out there living their curvy fitness life. Okay, all right, so I'm gonna be showing you guys a lot of the goings-ons this morning, a lot of how these events take place. I see the tents are up. Should I have gotten a tent? I didn't know I could have brought a tent. If I knew, I would have brought my tent. And you know, your girl left the house without any promotional items. Y'all, I don't be prepared for these events sometimes. I don't even think. But anyway, I was so focused on the walk, on getting myself ready for the walk. I even gave myself the best foot rub this morning to get my feet ready. Listen, my foot was like, who is this girl? And where's she been? Yeah, sometimes you got to really take care of your body, and not just getting the nails done. And nails are important, don't get me wrong. Make sure your nail health is on point, period. But also make sure that your muscles are ready when you're trying to get them to endure and to do something that's strenuous. You want to really take care of your body, hydrate them, massage them, stretch them. That's the part where I tend to fail. I'd be like, okay, we done, we out, let's go on to the next chore for the day or errand for the day. But really, you gotta stretch those muscles out, treat them well, because if you don't treat them well, they will snap and hit you back, literally. Okay, all right, so anyway, let me get myself going, y'all. I'm so excited. Y'all excited for this day? I'm excited for this day. I'm hoping for a great turnout, but if it's anything like the funds that were raised, which surpassed all the goals, I expect that we're gonna have a really good turnout today. It's a beautiful day out here. It's really a beautiful day. It's a beautiful city to be in. Hey, y'all. All right, I see you. All right, let's head out there. Let's go check in. Love and happiness.
Let's give it up.
Woo! Woo!
Give it up for yourselves. Thank you for bringing the children, the aunties, the grandmas. This is a village effort. My name is Keisha. I am a
Hey, Keisha.
lactation educator as well as a statewide coordinator for the Earth Lab. Our table is here. We are wanting to take a moment to thank everyone for joining the Culver City Promise Walk for Preeclampsia. This is really the Los Angeles County Promise Walk. We are so happy you're here. few minutes today to read a few of the stories at the preeclampsia.org. While you're there, consider signing up for the preeclampsia registry as well. Whether your pregnancy was healthy or affected by hypertensive disorder, your information can help researchers in the quest to find care. Everyone here at the Culver City Promise Walk and at the Preeclampsia Foundation is grateful to all of you who have stepped up to save mothers, babies in this challenging time. Your efforts are raising awareness of hypertensive disorders of pregnancy right in your community. Your fundraising is providing literature to doctors and blood pressure cuffs to women. Your fundraising, research, grants, and advocating for equity in healthcare. You are saving lives. Again, let's clap it up for saving lives.
Dr. Shantae Gray. I'm one of the OB-GYNs here in the community. I see some familiar faces here today. I'm also a survivor of preeclampsia. So this is something that's very passionate. So I wanted to start by just giving a little bit of information. I think, the big thing with preeclampsia is just being aware of the symptoms and things that you can recognize at home and being able to recognize those things and know when to come and get help. So pre-eclampsia, pre means before. Eclampsia is seizures that can happen when you have elevated blood pressures in the pregnancy. It's a disease that is mainly affected by the placenta. We don't really understand all that much about the mechanism of how it happens. We just know it has to do with the placenta, and we know that the cure ultimately is delivery and ongoing maintenance. With preeclampsia, the really big thing is making sure we recognize it, diagnose it, and treat it early and as soon as possible. And then after we do the initial treatment, it just doesn't stop there. We keep going until we know that you've recovered pretty fully. With preeclampsia, anybody is at risk for preeclampsia as long as you're pregnant. It's usually diagnosed 20 weeks or above, so mid-pregnancy all the way through postpartum period, 6 weeks after you deliver. With preeclampsia, the number one things are going to be symptoms for you: headaches. If you have headaches are so non-specific, right? You can have a headache because you're tired. You can have a headache because you didn't eat. But if you eat, you drink something, you take some Tylenol, and that headache doesn't get better, that doesn't seem normal to me. So if I were you, and I'm telling you to, go get checked out, okay? Because that could be a headache that's telling us that something's not right with your blood pressure. We can check your blood pressure if we need to. We can check labs. If we don't find anything there, it may just heighten our awareness of maybe you're at risk for developing something down the line. Other things like vision changes, right? So, you look around, you start seeing floaters. Those floaters may last a few seconds. But if they're lasting longer than a few seconds, you close your eyes, you're still seeing them. Maybe go get checked out. Blurred vision. You had normal, vision before, even if you didn't have normal vision. But all of a sudden you're looking at the sign and you're like, I really can't focus on that. Let me go rinse my eye out or put some eye drops. I still can't focus. Please go get checked out. One of the other ones that most people ignore is belly pain. So if you're having belly pain here, and you're like, I didn't eat anything different, I'm passing gas, I'm having normal bowel movements, check it out. Go talk to your provider, talk to your doula, advocate for you, talk to your OB-GYN provider, your midwife, whoever's taking care of you, and really just have them evaluate that. Sometimes it's nothing, but it's better if you get checked out and find that there's nothing wrong. The big thing with preeclampsia is if we miss it, it can be potentially life-threatening, okay? Even if you survive from preeclampsia, you can have ongoing problems from things like the seizures, right? Or strokes. The number one killer of women with preeclampsia is an hemorrhagic stroke, meaning you bleed into your brain. And that's mainly because those blood pressures are so high that it can cause the bleeding into the brain, okay? When we diagnose preeclampsia, it just really depends on where you are in your pregnancy, what we do. If you're really early on, sometimes it's just ongoing observation, sometimes it's in the hospital, sometimes it's as an outpatient. If you're in the third trimester, sometimes it's just going forward with delivery a little bit earlier. A lot of people are surprised that they get diagnosed with preeclampsia. It is not a personal thing. It doesn't reflect on you. It doesn't mean that you're sick. It doesn't mean that something's wrong with you. It all has to do with the placenta and how it's set up inside your body. And at that time, it's better to get treated and diagnosed and watched afterwards. There's a lot of research going into preeclampsia. We don't always get the populations that we need to study. So if you are willing and able, participate in research if you can. If not, at least participate in reviewing the research information, join groups, support groups, tell your stories so that we can continue to get better as providers, and that we can continue to raise awareness in the community. I'm a big supporter of second opinions, okay? So if you're my patient, I don't care if you ask 15,000 people. If you're not comfortable with the information you're given, ask somebody else. Ask as many people as you need to. If you get consistent messages, it's probably the right thing. If you start to get inconsistent messages, then you need to keep looking for the answer, okay? If you feel unheard, find somewhere that you feel heard. I mean, for us, we think we hear you, right? We think that we're speaking clearly. What we're saying to you, you understand clearly. But you may not, and that's okay. You gotta find somebody who speaks the way you understand it, and really can get to the root of what you need, okay? If anybody has any questions about preeclampsia, I'm happy to speak to you about it. We're still learning so much, and I'm just happy to be here. I have my beautiful gift there on my preeclamptic journey. So mine was caught relatively early, but it was because I knew my body. Okay, so just know your body.
Thank you. Awesome.
So a little bit about my story. 7 years ago, I was pregnant with Zende, who, y'all can hear me? Okay. I was pregnant with Zende. Somewhere over there. First pregnancy. And something didn't feel right for all of it. And I was hypochondriac. I'd call the nurse advice line, hey, this doesn't feel right. Get some rest, drink some water. You're okay, kind of thing. Like, oh, you have a history of migraines. It's okay. Continue on. Valentine's Day. I was supposed to go see Erykah Badu. If you know me, I love Erykah Badu. And I missed that concert because I was like, I don't feel good. A week later, I went in for my prenatal appointment. I was 28 weeks, 5 or 6 days. And my blood pressure was 179 over 119. And I had a protein count 7 times the normal limit in my urine. So I was shipped over to labor and delivery. Stuck an IV in me and said, you're not going anywhere. They gave me 2 days of steroids, a running magnesium drip, and 2 days later, via cesarean at 29 weeks and 1 day, I had Zende. He was 2 pounds 1 ounce. When he was born, he spent 9 weeks in the NICU, and I spent a week in the hospital after that. So this is a passion project for me, and I didn't know that. I have no recollection of it. But when I got pregnant the second time, and I sat in her office for my first visit, we made an appointment, and she walked into the room and she said, I remember you. That I had scared everyone that you had been. I'm so grateful.
Yes.
And not everyone has made it. Not all babies have survived. 76,000 women, 500,000 babies yearly pass from complications. So again, I thank you.
Thank you. Thank you. Thank you.
ready to hear the resources.
Woohoo!
Okay. Good afternoon. It's still morning. I'm sorry. First, I wanted to thank Kristen for inviting me. She was with us for the KJLH Women's Health Expo for our Black Infant Health, African American Infant and Maternal Mortality Prevention Initiative, but primarily our Abundant Birth Project, which was a guaranteed income pilot for pregnant women who are at risk for the most disparate outcomes. So we were able to enroll 410 women.
Woohoo!
Yes, exciting. These women have been enrolled. We started in January of 2024. We closed the enrollment period in May, I want to say April, May of this year, and successfully enrolled 410 women who are receiving $807 a month for 18 months. And so we had this activation in May and invited folks out because we really want folks to know about the risk associated with pregnancy and parenting for Black mamas, birthing persons in our nation. We have the highest rates of infant mortality and maternal mortality and morbidity. And so the work that we're doing, it is not selfish work because when we improve for one, we improve for all. So the work that we've been doing, we've been able to get, I don't know if many of you know, that women who are pregnant and are on Medi-Cal can have a doula at no cost to them that is covered through Medi-Cal. How many of you know that? Because a lot of times, you see just a few you guys are DJ too. So it is good to know because a lot of times, we see the times that we're in, and sometimes folks have to have other forms of insurance they can't pay, or they have employers that do not pay. And so if you're on Medi-Cal, that is an option that came through SB 65. That is the California law with us. Also, SB 464 was created by our current supervisor, Holly Mitchell, who was the former senator, along with Black Women for Wellness, Mobese, Mama Flynn, and a number of other organizations, Western Law and Poverty, and my friends over at National Health Law Program, to ensure that women have dignity during their pregnancy, and that we also make sure providers are accountable, and that we also collect the data because data was not being collected over the loss and death of women as it relates to pregnancy and parenting. So this type of work that we're doing is critical to the survival and thriving of such. And so what I was able to do is bring a number of colleagues together back in 2018 to start our first African American infant and maternal mortality community action team. We started in South LA, South Bay, and now we have 3 others. We are ensuring that this policy is just not for us, it's really for all who are pregnant and birthing, and we have done great work. So with that great work, many of the folks that we're partnering with, I started with Black Infant Health Program. If you know a pregnant Black woman, please refer her to the Black Infant Health Program. If you know someone dealing with, even youth, dealing with domestic or intimate partner violence, please refer them to Positive Results Corporation. And there's so much more that Melinda and Candy and the team are doing. The Earth app, started by Kimberly Seals and theirs and her other co-founder, to ensure that Black and brown women have the opportunity to use like a Yelp-like review to report, or not really report, but share if they had great success with a doula, if they had great success with a doctor, and if they did not, so that we can prevent these type of things from happening. Breastfeed LA supporting. Where's Jennifer? Jennifer created through our partnership and work with Jennifer came up with a support group called Titties and Tea to ensure, you know, because you got to talk over that breastfeeding and get the support you need. So it's conversation over tea and breastfeeding, right? And then you got my colleagues over here, Mind Body Birth, Chala, Faith, Tamara. They're doing such a great job. I was at their birthing center last night. One mama had just birthed, and then we had my friend's niece who came all the way from Japan to birth back here. And yeah, because sometimes you don't have the insurance there, you got to come back home and get the coverage and support you need. And she said, I want to birth this way. And so that's the work that we're doing to make sure people can birth the way that they want to birth. My community action team, if you want to join, you don't have to be black to join. You don't have to be black to improve outcomes. I can join anything that I want to do to improve the outcomes here. We know in this nation what we're experiencing, they're trying to take us all out. They're not being fair to none of us. And it's important that we the people are the ones that make the decisions to ensure that we thrive and survive, you and your entire community. So we have an expectant fathers group cohort that meets every 6 weeks. My coordinator, Davion Malden, is hosting this. They just started they'll start the second session this Tuesday. And that cohort allows men to have the opportunity to learn of the risks associated with pregnancy and parenting, especially for Black women. Labor and delivery is next week. Then he goes through postpartum support and postpartum depression, infant care, safe sleeping, and then there's a resources and recap. And we have some of the men out here becoming fatherhood ambassadors to encourage other men in the knowledge that they should have, because all women who are pregnant and parenting are at risk in some form or fashion. And that includes morbidity like mortality, like my sister doctor over here shared about preeclampsia. That can impact anyone. Postpartum depression, mood and anxiety disorders. It does not have any color coded to that. So brothers, I see you all out here. You need to know that the journey that we go through from the whole reproductive life cycle, you should be aware of, even into menopause. Because some of us get into menopause and we can't stand you. You wonder why. And then we know what it's what the body is going through, the experience. So it's not that easy and that simple. So I'm going to wrap that up and just, I caught y'all back over here too with my girlfriend Rochelle from work. I'm talking to you brothers too. Anywho, I want you to check us out, follow us on Black Infants and Families LA. I want to thank Kristen again for such a powerful, wonderful job of bringing all these women together. Fight to end preeclampsia, because we don't want to just inform. We want people to be informed, aware, and we want to end. Right? And we want to look for healthy options to support us in this journey to improve health outcomes. So that includes nutrition, that includes awareness, that includes making providers be more accountable to our health and wellness. Finally, follow my sister right here, A Healthy Bump Club.
Thank you.
Dr. Tasca Moore. If you guys don't know, great OB-GYN right here, Dr. Tasca, she is amazing and she gives a lot of resources on her Instagram page. So follow her.
Thank you.
Let's go! Let's go!
Let's go! Woo! Woohoo! Yes! Loving it. Let's go! Woohoo! Black Mama Magic, yes! Woohoo! Woo! Yes! We are loving it. Let's go! We got the dancers going. Okay. Woohoo! Loving Black Mama Magic. Love it. Woohoo! We got the dance going. Okay. We are loving this. Yes. Woohoo! Okay, cheering section. Woohoo! Saw them meditating early. Love it. Woohoo! Woohoo! It is just so beautiful out here. I'm so excited. We're already on this walk. I'm getting my steps in today. And listen, the scenery out here, okay, let me make sure I don't hurt myself. The scenery out here is just so beautiful. The trees are beautiful. It's a great temperature. The sun is out. It's nice and quiet, except for my big mouth. Okay, y'all, so let's catch up with a few things about preeclampsia that you should know about. So the first thing you should know about preeclampsia is that it is a worldwide condition. So this is not specific to any particular population, though we do know that Black women, especially African American women specifically, are more likely to experience preeclampsia. So that's one of the things that we need to get out there, is to make sure that the community knows that this is especially important for us. And it's especially important also that not just the women are informed, but also that the families are informed. Because sometimes you can be having a symptom, and as women, we are oftentimes kind of justifying or explaining away our symptoms. And it's important to have another voice in your circle, in your personal circle, in your village, that may be able to encourage you, validate you, because sometimes we need external validation to know that, no, that headache doesn't sound normal. And I heard about this condition called preeclampsia that affects Black women disproportionately. Maybe you should call your doctor. I can't tell you how many times that happens. So it's really important that we are getting the word out there, but that we're informing not just the women, but the family, the entire village, the friends, the best friend. Okay? So that's my first tip. It is. Yes. So you guys, one of the greatest things about these events that we don't talk as much about is the opportunity to meet other great people doing amazing work in the community. Check this out.
I am supporting women with sharing nourishment, food, and in this time of their postpartum, they need something that is so beneficial for them. They don't need to worry about nothing. You don't need to think about your food. I will customize it. We will have a conversation. What you need, and then we'll create the meal surrounding that. That is so important for moms, especially in their postpartum time. We think about the baby, but it's really us that needs that nourishment. Important. Like,
that's
it's
true.
So important for us to have that nourishment. So that's how I'm supporting us. We're gonna have breakfast, lunch, dinner. I will do bedside service. Also is offered. Free services. Free delivery for anyone that's in the LA area. Also, we have fresh pressed juices, we have smoothie options, we have yoni steams.
Wow.
That is so important, especially as a mom that just had a baby. Yoni steams, I will do a whole herbal recovery teas. Recovery teas are so important, guys.
Yes.
All of these things will help you heal and feel better and back to yourself and your new self. Because when you have a baby, you create a new person. So you're a new person too. So it's so important for women to have.
So tell us the name of your business.
It's called Ooh La La Vegan. We shortened it and rebranded to OLV Living, because we are now doing everything under holistic living. It's not just about food, it's about living. You know, what is your food coming in? It has to come in glass. Should it come in plastic? No, it should come in glass, because glass is an element from the earth. So we're going towards living, because it's more about a lifestyle. Instead of just a diet. It's not just about the food for today, it's about the food for your lifetime. So getting and incorporating those things is so important. We also do virtual cooking lessons. So if you want to learn a recipe, if you want to learn something, how to make, I've been vegan for so long. I've learned so many tips and tricks and skills that I can pass down and share. We also do, brands and clothing and reusable bags, things like that. So we're just focusing on living.
I love it. You're in the healing space, is what I would say. Yeah. Now, why was this important to you?
It was important for me because when I had my babies, I I was cooking for myself. Right before I had them, I froze everything, I cooked everything, I prepped all my herbs. I did it all, and it was like, it was fun, it was great, but it was a lot. And it's like in that time you should be focusing on the next step. So I wanted to create that space that women didn't have to think about what are they gonna eat, like what, because my husband doesn't cook. I'm the chef, so if I'm in the bed, what are we gonna eat? You know? So I don't want no one to have to think about that, especially as a woman. We are always thinking about, okay, what can you eat? What are we gonna eat? You know? So I want to take that ease away from them and not have them worrying about that, not have them thinking about what are they gonna eat. So I think that's so important for me, especially having the nourishment. And my recovery was so fast, so I felt like I had something special. I felt like I had something that I needed to share with other women. So that's what drove me to starting it and just giving it out, because we're so important. Women helping women, we really thrive off that. So
yes, we do.
That's something that was really important.
We definitely thrive in community for sure. I love what you're doing. I love that you were so intentional about your postpartum, that you were thinking about it, knowing what you would need and preparing for it in advance. That's something we've talked about on our platform, is really being intentional about preparing for the postpartum period. And if you were to say an encouraging word for a woman that's out there that's kind of feeling a little overwhelmed because she doesn't have those resources, because she doesn't have the village or the community, how would you encourage her to get from this day to the next day?
I would say just take a moment for yourself. Just pause. It's okay to pause and just take a breath, because we do a lot. And sometimes we just need that moment for self to re-pour into our own cup and just give ourselves that love, and knowing that it's all right if I don't have all the resources right now, because right now is where I'm supposed to be at. So it's something in this moment that I need. So take that moment and pause and really be in your now. Be in your now.
Love it, love it, love it. Be in your now. We are so thankful for Chef Brianna for stopping by and sharing with us her incredible work, but also her passion behind her work. And yes, y'all, that is her infant son in the sling. He is so snuggled in. We are family. Oh. We're about to walk through for the third time. We're going to walk through backwards this time. And third lap down. Third lap. Okay, y'all. So let's talk about the other part about preeclampsia that you don't really hear a lot of people talking about. And it is the long-term impact it has on your health. And so one of the things that you should know is that experiencing preeclampsia means that you should continue to have ongoing surveillance for some of the potential outcomes. So we know that people who have experienced preeclampsia are more likely to have renal disease in the future, more likely to have chronic hypertension. That's probably one of the most common outcomes. And also more at increased risk for having heart disease and strokes. So this is why studying and understanding preeclampsia is really important, because it's more than even surviving the pregnancy and the postpartum period, and that in of itself is a big deal. But it's also about making sure and ensuring that women are able, as they become moms, to then have healthy lives as a mother, right? And so make sure you are supporting and funding groups that are doing the hard work of researching, because no mom should have an experience that compromises her life expectancy. And that's really what we're talking about when we talk about some of these long-term outcomes. So let's make sure we get the word out so that becoming a mom doesn't cost you your life. Getting to my fourth lap. Woohoo! Am I the only one still walking?
No, you can others. We'll let you on.
Okay, awesome.
No,
4.
You'll get there. I believe in you.
Thank you. I'm gonna check in and go back. Woohoo! I love the energy, man.
Yeah.
Woohoo! Woohoo! Listen! I am so proud of Dr. Merchant. She did such a great job for the first event and was so vulnerable in her testimony and really showed us just how much these families are impacted by preeclampsia. It's more than just a condition at childbirth. It's the sequela that happens, the emotional health, the physical impact that it has. So thank you to Dr. Merchant. You will see her on another video on our platform. Make sure you go check it out as we talk about preparing for childbirth and utilizing physical therapy in our preparation and in our childbirth experience and in our postpartum recovery. So make sure you check out that video with her, okay? All right. As you guys can see, we had such a beautifully inspiring day. It felt like hey! Hello! And we even had time to do a little bit of a TikTok video. Check us out. It was a fun day, but more so, it was an effective day in making sure that we were able to raise awareness for preeclampsia and to fund the work behind the awareness. So thank you to everyone that contributed to our event, and we thank you so much, and we hope that you too will be spreading awareness in your own village, in your circles, so that we can continue to save lives. Thank you for watching. Hey you guys, congratulations to Dr. Merchant. What an amazingly successful event. Everyone's kind of packed up and gone, and I just wanted to thank you guys for following along today. Thank you for everyone who supported us financially in prayer or just sent words of encouragement. We appreciate y'all. And this is Dr. T, the hand behind the handle of Healthy Bum Club right here on YouTube and HealthyBum.Club on Instagram. We thank you guys for following along with us today, and I hope to see y'all in the next episode. And we're out. This is Dr. T, just a friendly reminder, don't forget to comment, like, and share, and go ahead, why not click that subscribe button. Help us to get to the next 1,000 subscribers.